Hi, my name is Amber Martin, and the topic I chose was deinstitutionalization. Deinstitutionalization has played a large role in the way that psychiatric treatment is organized today. Just to provide you with a little background about deinstitutionalization and what led to it. In the 1950s, a movement began that involved transferring patients that were housed in psychiatric institutions to community outpatient treatment or care for their mental illness. In 1963, there was an act that was passed called the Community Mental Health Construction Act. This act was passed by the federal government, which provided grants to states if they would establish local community mental health centers. Also, during this time frame, psychiatric medications became more prominent and being more developed and used, becoming FDA approved. There are roughly 14.8 million people who suffer from severe mental illness, and severe mental illness is defined by it's debilitating. The person needs to be housed in specialized institutions to help treat them for their mental illness. And about 16% of these individuals reside in prisons and jails. As we witnessed in the documentary with the gentlemen that were suffering from severe mental illness and became repeatedly incarcerated or put into prison and jail because of arguments or petty crimes or things that they normally wouldn't do if they were taking their medications. But we also saw by watching the lives of those individuals that most of them did not have the resources, they did not have the family support, and they did not have someone to constantly watch their care and make sure they were taking their medications, make sure they were taking going to their psychiatric or psychiatrist appointments, that this led to them becoming repeatedly incarcerated. And this is a very vulnerable population because this population is in need of mental health services, but at the same time they really don't know how to access them, or when they access them, they don't stay on them for a long extended period of time, as we saw in the documentary. This poses a very huge challenge for our human services personnel, because these individuals need a lot of support, a lot of attention, a lot of linking to different services, but at the same time, how do they link them to the appropriate services, and how do they keep them linked to the services if the patient or the person is still dependent on continuing to be involved in those services? What I set out to do in this research project was to find a link between deinstitutionalization and the increased amount of people that with severe mental illness that are housed in prisons and in jails. Unfortunately, I was unable to locate a lot of current, up-to-date research-based evidence or good educational, scholarly articles with this information in it. So I will present the information that I was able to obtain in the articles that I found. For instance, one article was a research article that was done, a research study was done in Finland, where they set out to prove that deinstitutionalization has created a revolving door phenomenon where patients would be more stabilized if they were in an institution or a long-term psychiatric ward rather than outpatient community centers. Unfortunately, the evidence that was obtained in this study actually showed that instead of stability, the rehabilitation that was provided in the hospital setting actually made those individuals more likely to be dependent and need further institutionalized care than becoming more independent on their own. Another study that I was able to look up was also done in Finland, where it set out to say that after deinstitutionalization, there was an increase in suicide rates for people that were suffering from severe schizophrenia. And unfortunately, also in that research article, they found that there was actually a decrease in the amount of suicide following deinstitutionalization than before deinstitutionalization occurred. So that was an article also that kind of supported the process of deinstitutionalization. On the other hand, I found an article that was published by a doctor that was stating just some of the consequences of deinstitutionalization. For instance, we have a lot of people suffering with mental illness that have committed horrific crimes in the United States over the past 30 years, and come to find out that that individual was suffering from severe mental illness. And if the doctor was saying in his article that if we have institutions, psychiatric institutions for the individuals that have the severe mental illness, that possibly these incidents could have not happened, not occurred, because we would have had the facilities to house and to treat the severe mental illness that the individuals were suffering from. And also, such things as community out-based centers are not discredited in his article, but he also emphasized that the resources and the availability of community resources needs to be made more available, or it needs to be more resources, because right now the resources are limited, although they are available. Another article I found, basically we're saying the same thing, similar to the first two, that deinstitutionalization, although it had negative side effects, that having psychiatric institutions were not all positive either. So in my conclusion of my research, it was a very conflicting and confusing results that I found. And me personally, I feel like it needs to be a happy medium. Community resources are excellent. They are a good resource for people who can readily use them and readily access them and have the mental capacity to go to them and use them appropriately. But on the other hand, I feel that psychiatric institutions still should be an option for those who need involuntary commitment until they're able to become where they can use the community resources on a consistent basis and stay mentally stable. For instance, some of the individuals that we watched in the movie were able to get into certain programs, but once the programs were not making them take their medication. So once the gentlemen stopped taking their medication, they became psychotic again, they became violent again, and they ended up right back in prison. So the resources were available, they were using them, but at the same time they really didn't benefit that individual, because maybe that individual for a certain amount of time needed intense treatment and then maybe be transferred into the community outpatient setting. For instance, in the article that said deinstitutional, that proved that actually housing people and rehabilitating them in the hospital made them dependent on institutions, maybe it needs to be a transition from being in a psychiatric institution to transitioning them into the community, so that it won't be such of a culture shock and lack of dependency on just the institution to provide them with care for the remainder of their life. So personally, that's how I feel. It needs to be some kind of transition from severe, housing people into severe structures to putting them into a community-based setting where they're living in the community, working in the community, but also have still the connection with the services as needed. So I hope this information has helped. I've learned a lot, and it kind of opened up my mind to think about things a little different from the way I initially started off. Thank you.